Are growing concerns over heat-related deaths caused by the high temperatures sweeping across the nation.
In the Pacific Northwest, several cities recorded record-breaking temperatures this week. Excessive heat warnings are in effect through Saturday evening. That heat is being investigated as the cause of death for 4 people in Oregon. The CDC estimates more than 700 people die each year from extreme heat in the U.S. The agency says more than 9,000 people are hospitalized from high temperatures every year.
For more on this is Kristie Ebi. She joins us now. She's a professor at the Center for Health and the Global Environment at the University of Washington. Thanks so much. Kristie, based on your research, who's most likely to die from extreme heat?
Thank you for covering this important issue. There's a long list of people who are at higher risk during high temperatures. There's adults over the age of 65, people with chronic underlying medical conditions, heart disease, for example, diabetes, obesity. Children, very young children, are at higher risk. Pregnant women towards the end of their pregnancy are at higher risk for having low birth weight babies. Outdoor workers, anyone who has higher exposure to the heat because of where they live, such as red line districts, also need to be aware of the risk of heat and know what kinds of actions they need to take to protect themselves.
Kristie, these are some scary groups of people you're talking about, a lot of people impacted. What are some steps communities can take to prevent these kinds of deaths when the temperature does rise?
The most important is developing heat wave early warning and response system. So not just knowing it's hot, but knowing what it is that people can do to keep themselves cool. And importantly, to be able to do that without having access to air conditioning, because many of the vulnerable groups don't have access to air conditioning. And this is things such as sitting in front of a fan and spraying yourself with a little bit of water. As you know, when we're in front of a fan, as that water evaporates, it helps cool down our core body temperature. In Seattle and in other cities right now with heat wave early warning and response systems, we have cooling shelters that are open so people can go and spend a few hours during the day cooling themselves down and making sure that they are protected. It's particularly important when there's high nighttime temperatures, because the high daytime temperature combined with that high nighttime temperature means the heat accumulates in our bodies and makes us more at risk for heat stress, heat stroke, and ultimately death from other causes.
Across the country, you haven't seen record heat, and I might mention record humidity like this before. Some areas don't have air conditioning because it isn't really something that they had foreseen needing. So the big question here is how much of this is an impact of climate change, and how much does climate change impact the number of deaths, heat-related deaths every year?
We're entering an era where climate change is increasing the intensity of almost all heat waves. We know from specific studies looking, for example, at the Pacific Heat Dome a year ago here in Seattle, Oregon, and in British Columbia, that event was virtually impossible without climate change. We see other events, such as the events we saw earlier this year in India and Pakistan, where climate change made the event 30 times more likely. And so climate change is definitely contributing to these very intense events. Projections are that these events will increase in frequency, intensity, and duration. And given the rarity of some events, we can say that people are actually dying from climate change. And that means we're in a new era of discussing the challenges we're facing with global temperature rise.
Such critical insight. Kristie Ebi, thank you so much.